Good morning. Thank you all for being here at our newly renovated operations center. I think some of you have been to the older operations center, but before I bring him up, I do want to take a minute and talk about our transportation system. The governor was here this morning. We were giving him an update first thing on what our system looks like after the storm we had to deal with yesterday. You know, it was a pretty tricky and complex storm for us across the board. Sunday weather conditions were around 60 plus degrees. So as predicted, the precipitation started as rain. So it limited our ability, but it transitioned between 4 a.m. and 5 a.m. in most areas. And when it starts with rain like that, we don't have the ability to go out and pre-treat. So that puts us at a little bit of a disadvantage. But after 7, it started to really fall down. And then the storm intensified between 7 and 12. The heaviest snowfall we encountered was centered in Prince George's County, Anne Arundel County, Charles, and Calvert. South to east, it was a pretty diverse set of impacts. We had about 4.5 inches in Harford County, all the way to 12 inches in Denton and La Plata. The rate of the snowfall was a particular challenge for us. We had up to 2 inches an hour with one period where we had 8 inches of snow in a 5-hour period. When you think about most of our plows running a 60 to 90 minute loop, the roads were being covered as quickly as we could plow them. Overall, when the cold air came in, we were dealing with some refreeze and system impacts, but our chart patrols responded to almost 500 incidents. That's about 4 times our normal average. MSP responded to about 220 crashes and another 260 disabled vehicles and more than 1,000 calls for service across the board. Making things more challenging was what we were dealing with in terms of the limitations with our pandemic and the traffic and the protocols that we have in place. Traffic volumes on Monday were about at or a little bit over our normal everyday volumes. Greater incidents and then prevented us from getting out there as quickly as we could. But that heavy wet snow, we're taking some trees down, and that resulted in some utility lines coming down. The Route 50 corridor seemed to be our toughest spot and our most challenging area of focus for the day. So we were continuing to fight that. We were fully staffed, and then our COVID protocols allowed us to spread out and get a little bit more of our private sector resources and move resources from across the state. And so we will continue to fight that fight. By evening rush hour, most roads were either completely clear or had some isolated coverage, but the sunlight came out around 9 or 10 this morning, and that's really helping us. Just looking at kind of where we sit today, about 95% of our statewide network is in overall pretty good condition. We have some ice pack and some icy conditions on some of the mainline roads at this time. Temperatures, when temperatures are below 20 degrees, salt is not effective, so we have to mix it with other materials to be able to fight that ice. But we're expecting pavement and air temperature to get above freezing by midday, and we'll continue the cleanup. The local roadways are going to continue to be a challenge as their resources are limited as well. On the air side, we do have reduced passenger volumes at BWI Marshall. 44% of our departures and arrivals yesterday were canceled due to the storm. That's 290 flight cancellations and 160 delays across the board. Today, we're sitting at about 115 cancellations, and that's mainly with where they're headed and where they're coming from. And 16 delays so far today. TSA is fully staffed and all of our runways are open. Over on the transit side, our core bus system is working at full capacity today. Our biggest issue is we don't have the ability to use the articulated buses in icy conditions because they have a rear wheel power, and that doesn't work on icy roads, so you have to pull those bigger ones out. But our supervisors are out limiting diversions, those types of things. But our MARC and light rail are fully operational. Over at the MBA, we have a couple of issues that we're trying to work with today. The Prince Frederick branch office is going to be closed today because the Calvert County Courthouse is closed, and that's where our offices are. And we're not able to give driver skill tests in Baltimore City, Beltsville, Easton, Elkton, Essex, and Glen Burnie, as well as Largo and White Oak today due to the conditions. But the appointments are available, and we're going to start working through them at the other locations. So at this point, I'm going to be happy to take any questions at the end, but I'd like to turn things over to Governor Hogan to give an update on our fight against this COVID-19 pandemic.
Thank you. Good morning. Secretary Slater, thank you for that update, and thank you for your incredible service to our state. You've been an invaluable member of our team, You've been an outstanding Secretary of Transportation and a big part of the reason we've had so much tremendous success in rebuilding Maryland's infrastructure. I also want to give a shout out and thank all of the SHA crews who've been working around the clock to clear state highways from yesterday's winter storm. I'm now going to move on to the COVID-19 emergency. Last summer, we were able to transition from the crisis phase of the emergency to a more sustained, ongoing, long-term public health management response. But I warned back then that COVID and its variants were going to be with us in one form or another for the foreseeable future. Right now, we're experiencing the winter surge that we anticipated, together with the convergence of the Delta variant, the flu season, and the Omicron variant, which has spread like wildfire throughout the country and around the world. Our focus has been and continues to be on preventing hospitalizations and deaths. Today, Maryland hit a record high of 3,057 COVID hospitalizations, which is an increase of more than 500% in the last 7 weeks, and which is now overwhelming normal operations at hospitals. Last month, we established a surge operations center to optimize bed capacity and to fully utilize the alternate care sites that we stood up early in the crisis and which we continue to keep in place. Health officials issued a directive requiring hospitals to undertake actions upon reaching certain thresholds. When they reached 1,200 COVID hospitalizations, Maryland hospitals began efforts to reduce the scheduling of certain non-urgent medical procedures to open all staffed bed capacity. When they surpassed 1,500 hospitalizations, Maryland hospitals immediately implemented their detailed pandemic surge plans. We recently committed $100 million in emergency funding for Maryland hospitals and nursing homes to address urgent staffing needs. This included $50 million to stabilize hospital workforce and staffing needs, and another $50 million for hospitals and for nursing homes to expand the availability of COVID-19 testing, treatments, and vaccines. State health officials are now requiring all nursing homes experiencing an outbreak to offer COVID-19 therapeutic treatments for residents. While we can't manufacture doctors and nurses who don't exist, we have continued to do everything we possibly can do at the state level in order to help our hospitals withstand this surge and to save lives. From day one of the crisis, I have told it to you straight. And so the truth is that the next 4 to 6 weeks will be the most challenging time of the entire pandemic. Our newest projections as of today show that COVID hospitalizations could reach more than 5,000, which would be more than 250% higher than our previous peak of 1,952 last year. While we are hoping for the best, we are actively preparing for the worst. Moments ago, I issued a proclamation declaring a 30-day state of emergency to take urgent short-term actions to combat the current crisis. I have also enacted 2 new executive orders. The first gives Maryland's Health Secretary the power to regulate hospital personnel, bed space, and supplies. It includes the ability to direct and expedite the transfer of patients between hospital facilities as necessary. This executive order allows the Maryland Department of Health the authority to establish additional alternate care facilities to assist hospitals and nursing homes in addressing staffing shortages. The executive order allows interstate reciprocity for healthcare licenses. It allows inactive healthcare practitioners to practice without needing to reinstate their expired licenses. And it authorizes graduate nurses to work at any healthcare facility and to provide full nursing services. And the order allows for healthcare practitioners to practice outside the scope of their licenses. The executive order also authorizes the health department to regulate elective medical procedures as necessary and to issue directives to control and monitor COVID-19 in nursing homes and similar congregate care facilities. The second executive order authorizes additional steps to further augment our EMS workforce, which is on the front lines and also being overwhelmed with COVID patients. Today, at my direction, we are mobilizing 1,000 members of the Maryland National Guard to assist state and local health officials with the state's emergency pandemic response. Approximately 250 members of the Guard will be deployed to support COVID-19 testing sites across the state, including at hospitals and skilled nursing facilities, and to assist with patient transport as needed. Last week, we opened 2 new state COVID-19 testing sites at the University of Maryland Upper Chesapeake in Bel Air and at Anne Arundel Medical Center in Annapolis. These new sites are accepting walk-ups with no appointment necessary and are open 7 days a week from 9 a.m. to 3 p.m. Today, we are assigning additional National Guard soldiers to support operations at these state-run sites. In addition, they will be assisting us in the opening of another 20 testing sites outside hospitals all across the state in order to meet the rapidly rising demand for testing and to divert people away from visiting hospital emergency rooms just to get COVID tests. As I have been repeatedly saying over and over again, the single most important thing that you can do to protect yourself, your family, and your fellow Marylanders from this virus and its variants is to get fully vaccinated and to get a booster shot. Throughout all of 2021, nearly 75% of those who tested positive for COVID-19 in Maryland were people who had not been fully vaccinated. Nearly 84% of all our COVID hospitalizations for the entire year were people who were not fully vaccinated. And more than 84% of the more than 4,700 additional Marylanders who died from COVID-19 last year were not fully vaccinated. These are not opinions or judgments. These are undisputable facts. The vaccines are safe and effective, and they're keeping people out of the hospital and saving lives. Following the latest action from the FDA, State of Maryland is now able to provide COVID-19 booster shots for children between the ages of 12 and 15. Marylanders are now also eligible to get a booster 5 months after completing their primary doses of either Pfizer or Moderna, instead of having to wait until 6 months after being vaccinated. Today, I have a call with the White House right after this press conference, and today I am urging federal officials to consider shortening that time frame even further for vulnerable people, particularly those in nursing homes and congregate care facilities. In November, Maryland health officials authorized providers across the state to immediately begin scheduling appointments, holding clinics, and vaccinating the 515,000 eligible 5 to 11-year-olds in Maryland. While 92% of all Maryland adults are vaccinated, to date, 33% of the 5 to 11-year-olds in our state have been vaccinated. We all want to keep our schools safely open because there's absolutely no substitute for in-person learning. And one of the best ways to do that is to get more of our school-aged children vaccinated as soon as possible. Yesterday, we announced that face coverings are now required in all state government buildings in Maryland. And to encourage booster shots among state employees, the state is now providing 2 hours of paid leave for any employee to get a booster. We're urging other employers across the state to follow our lead by providing leave for vaccinations and for boosters, and by strongly encouraging the wearing of masks or face coverings indoors. Next to the vaccines, wearing masks is one of the best mitigation strategies that we have. Everyone got a little complacent, and I think maybe thought that we were starting to get back to normal. But with this new surge of Omicron, it's important for Marylanders to get back to using common sense and to doing the things that kept us safe before. Avoiding crowds, keeping your distance, washing your hands, and yes, wearing the damn masks. All of the emergency actions that we're taking today are to keep our hospitals from overflowing, to keep our kids in school, and to keep Maryland open for business. And we will continue to take whatever actions are necessary in the very difficult days and weeks ahead. But we also need the federal government to take decisive action. Today, I'm calling on the Biden administration to take immediate actions to increase the distribution of monoclonal antibodies, which are very effective, life-saving clinical treatments. Last month, we began distributing 1 million at-home rapid tests through local health departments, and we are working on emergency procurements to acquire as many more as we possibly can. But there is a serious national shortage, and the federal government needs to immediately expedite the approval of additional rapid tests and to push to increase production and distribution to the states. We're also calling on the Biden administration to increase and expedite production and allocation of the new COVID-19 antiviral pills, which were recently authorized by the FDA and which are another much-needed tool to prevent serious illness and death. Finally today, as we enter the third calendar year of this global pandemic, I want to again take a moment to thank all of our amazing healthcare heroes who have faced immense, unprecedented, and never-ending challenges. For the past 2 years, these men and women have selflessly and tirelessly worked around the clock and have made countless sacrifices to keep Marylanders safe, to treat patients, and to save lives. If you have a chance, please take a moment to thank them and their families. These heroes truly are the definition of Maryland strong, and our state owes them a tremendous debt of gratitude. May God bless each and every one of them, and may God bless each and every one of you and your families as we stay Maryland strong and as we continue to fight this battle together. At this time, I'm going to turn it over to Major General Tim Gowan, Adjutant General of the Maryland National Guard, who's going to provide an operational update regarding the deployment of the 1,000 members of the National Guard across the state. General.
Thank you, Governor Hogan. Good morning. Over the past 2 years, we've worked closely to support the Maryland Department of Health and other state agencies to help ensure a rapid and unified response to the COVID-19 pandemic. If one characteristic has epitomized the Maryland National Guard's response to COVID-19, it has been adaptability. Time and again, we have rapidly pivoted to meet the needs of the community as new challenges arose. This activation is no different. Last week, 40 soldiers already on duty supporting the Vaccine Equity Task Force were promptly reassigned to support COVID-19 test sites at the University of Maryland Upper Chesapeake Medical Center in Bel Air and at the Luminous Anne Arundel Medical Center in Annapolis. As the governor has stated, we will be activating up to 1,000 soldiers and airmen to assist state and local health officials with the state's pandemic response. Expected missions include COVID-19 testing, supporting local hospitals and skilled nursing facilities, and assisting with non-life-threatening patient transport. For every mission, Guard support will be tailored to meet the needs of each site. Mission details are still being worked with the Maryland Department of Health and local medical facilities. Other efforts to combat the virus will continue. The Vaccine Equity Task Force, led by Brigadier General Janine Burke, continues their efforts to increase vaccination rates across the state. I'd like to thank the Governor for his continued faith in the Maryland National Guard and to recognize our partners for their timeless work to protect the public from this virus, of which our efforts are only a part. Our Guard members are always ready to help the neighbors, families, and friends in their communities where we live and work. We are a community-based force made up of dedicated military professionals ready to answer the call when we are needed. This is what we do. This is why we serve. I'll be followed by Dr. Ted Delbridge of the Maryland Institute for Emergency Medical Services and Systems. Thank you.
Governor Hogan, Generals, Mr. Secretary, thank you very much and good morning. I would like to provide a sense of the healthcare system, first by reiterating what Governor Hogan said. We owe them a debt of gratitude, the thousands of people who go to work in Maryland every day with a clear focus to help others. Earlier in the COVID-19 pandemic, we applauded them as heroes, and signs and banners expressing our admiration and appreciation were abundant. Now, more than ever, they need our outward show of support. While our healthcare system and the skilled and dedicated people who comprise it are resilient, they have been tested over recent weeks and will continue to be tested in the weeks to come. Currently, there are 3,006 adults and 51 children with COVID-19 in Maryland hospitals, and that represents a 100% increase since December 22nd, or a doubling. Our hospitals are struggling to deal with the numbers of sick people coming to them. As of yesterday afternoon, more than 600 people, were waiting in emergency departments for their turn to be admitted to a hospital bed. In fact, our emergency departments are as busy as they have ever been. In many cases, they are being asked by people to provide evaluations and care that could be more appropriately sought in other places. Nearly all of Maryland's emergency departments are broadcasting what is called a yellow alert to the EMS system. In doing so, they are requesting that EMTs and paramedics take their patients to other facilities. Of course, that's not possible when every nearby emergency department is also requesting no new patients. To help EMS personnel in the field and their patients, we have developed a dashboard that tells them where ambulances are at area hospitals and how long they've been there. That way they can work to avoid facilities where there's been a recent influx of new patients and where there are significant delays. We have heard from our EMS system leaders throughout Maryland. Congested emergency departments lead to delays in transferring care of patients, resulting in less availability of EMS resources in the communities they serve and longer response times to emergencies of all sorts. We're in close contact with hospitals and EMS system leaders to make certain the issue is getting appropriate attention. In the past several days, it's been necessary for us to be more deliberate in advising EMS personnel to avoid specific emergency departments for limited periods, allowing them, the emergency departments, to catch up and regroup and help ensure that EMS ambulances do not become inadvertently sequestered. If you have needed the healthcare system recently, you have undoubtedly appreciated how much pressure is on it. Hospitals have postponed non-urgent surgeries and therapies. Currently, 9 hospitals are operating under what are known as crisis standards of care, and 3 others are poised to do so. Thus, 25% of Maryland's hospitals have adjusted their internal standards and operations, attempting to meet the needs of their communities. They have redeployed staff to where they are needed most to provide some benefit to the greatest numbers of patients. They have redesignated rooms and treatment areas to care for more people or sicker people than the rooms were initially designed for. They also continue efforts to move patients, especially those requiring intensive care, to places with the necessary capacity and resources and expertise. In fact, the Critical Care Coordination Center at MEMS, which serves to match critical care patients with available resources, experienced its busiest month in December since its inception in 2020. It serves as one of the nation's models to attempt to get patients to the optimal care they need. With today's announcements, we will move briskly to ensure we have engaged all those with knowledge, skills, and interest to contribute to the healthcare system. For example, students in nursing and respiratory care may be able to serve as clinical externs, providing assistance to beleaguered hospital staffs while gaining valuable experiences. There are actions we can all take. First and foremost, if you have not been vaccinated for COVID-19, I urge you to reconsider. I can think of no greater testimonial than to tell you that I and my family have all been vaccinated and boosted. I'm not advocating something I wouldn't do myself or encourage those closest to me to do. If you have been vaccinated and it's been 5 months, plan also to get a booster. It's incredibly disheartening and discouraging to be on the healthcare front lines and know that much of the current situation is avoidable. Vaccinations are akin to wearing a seatbelt, which is ironic. It might not prevent you from being injured in a crash, but it certainly reduces the severity and injuries and prevents fatalities. In Maryland, if you have not been vaccinated, you are more than 10 times more likely to be admitted to a hospital with COVID-19, and you're even more likely to require intensive care. It's just plain sad. For our healthcare heroes, it takes a toll. Last year, when we experienced a similar surge, there was no flu. Wearing masks, Keeping our distance and washing our hands prevented it. This year is different. Flu cases in Maryland are rising. The flu is more than a bad cold. It kills thousands of people each year, and it puts people in the hospital. Please plan to get a flu vaccine. Both the flu vaccine and COVID-19 vaccine are available at pharmacies throughout Maryland. There are times when people should go to an emergency department. Examples include chest pain that doesn't resolve in a couple of minutes, shortness of breath, new difficulty talking or walking, abdominal pain that doesn't go away, or anytime there's a concern that immediate help is needed. But there are other times when people should seek care with their primary care provider or at an urgent care center, reserving the emergency departments for more serious and acute problems. And some of those examples include to get a COVID-19 test. Don't go to the emergency department. Instead, go to one of the many testing sites throughout Maryland. And as we said, more are on the way. A useful resource to find one is covidlink.maryland.gov. Don't go to the emergency department to verify or validate an at-home or rapid test. It's not necessary. Rapid antigen tests are reliable. Especially if the test result matches the situation, there is no need to double check. For example, if you have symptoms of a cough and a fever and your test is positive, you have COVID-19. Stay home. To be evaluated because of a positive test. Unless you are short of breath, most people can take care of themselves at home. If you are at higher risk, touch base with your primary care provider. Additionally, many healthcare insurers also provide access to telehealth resources, where people can consult virtually with a healthcare provider to get advice without leaving their own homes. We must, all of us, continue to do our parts for our own health, our families, and our neighbors. If you're sick, stay home. Otherwise, wear a mask in public or crowded places. Wash your hands, keep your distance, and please get vaccinated. It's the very best tool. Thank you very much. Governor Hogan.
Thank you, Dr. Delbridge. With that, we'll take some questions. Brad?
Governor, you said many times this isn't March 2020, but there are those who call for more. Mandatory masks, all that sort of thing. Why are you doing what you're doing today and not going farther?
You know, our real focus is, as I said, keeping people out of the hospital and preventing deaths, and we're taking all of the steps that we believe are necessary right now, but we're going to continue to, you know, we're taking steps just about every single day, and we're going to continue to take the ones that we believe are necessary, as we have throughout the entire crisis for the past 2 years. And it sometimes has an opposite effect. I mean, I'm not sure the people that are refusing to wear a mask are going to wear one anyway. We don't have the ability to enforce it, so we're just strongly encouraging people to wear the damn mask, but we don't need a mandate to force businesses to do that. We're encouraging them to do so.
Governor Hogan, I'm curious how you're doing after having contracted COVID-19, and since that was a couple weeks ago, I'm wondering if you were able to get the monoclonal, the mAb, specifically for Omicron, because we know that the supply is pretty tight.
Yes, I'm doing fine, thank you for asking. I had a 10-day staycation in the basement of the governor's mansion. I got a lot of work done and continue to stay in touch with my team in the governor's office, and participated in a lot of calls, and even did a press conference Zoom from there at the beginning of my isolation. For me, it was like a pretty bad cold, and that's because I was fully vaccinated and boosted. I'm thankful for that, so I didn't end up in the hospital or dead like so many other folks have in Maryland. I was able to get a monoclonal antibody treatment early on in my illness, and very, very happy I had the chance to do that. I don't know whether that, I didn't feel any instant, they said you may feel instantly better. I didn't notice anything at all, but I didn't get sicker, so I'm happy we had that opportunity, and it's one of the reasons why we're continuing to call on. There's a shortage now across the country with respect to these treatments that should be widely available, and that's one of the things we'll be talking with the White House about later today.
Governor Hogan, the state of emergency today, I know the Hospital Association has been asking about it for a couple of days now. Why now and why not earlier, considering we've seen this steady climb of these measures?
Well, we've been taking actions with the hospitals nearly every day, and we put out information. Although we haven't had a press conference about it, you've seen press releases nearly every day with actions we're taking. In the Department of Health took dozens of actions with respect to the hospitals to give them the flexibility that they needed. I think they had most of what they needed. There was some concerns about, from a liability standpoint, for some of the smaller hospitals that weren't taking action because they felt I should declare a statewide state of emergency instead of a public health emergency that the Secretary of Health declared. But it's not like we just decided to take action today. We've been taking different actions every day, and it's now gotten to the point where, we crossed over the 3,000 hospitalization mark today, which is a major milestone. Our projections are dramatically different than they were a week or two ago, and so we decided to take further action.
Governor, it seems to be, from the beginning, we've heard this big debate about whether kids should be in school, they shouldn't be in school. The city yesterday basically gave a full-throated endorsement of getting kids back in a classroom with a lot of aggressive testing. What's your stance on that, and what kind of calls have you been fielding about how to make that decision?
Well, absolutely, I think kids need to be in school. I think we've all seen the incredible damage that has been caused by, in some cases, people doing remote learning for over a year. And so I agree with all of the elected officials yesterday that came out in support of in-person school. We've provided unlimited amounts of money and testing and the ability to provide vaccines for the kids, and the kids are doing pretty well. I mean, we've got some outbreaks in some schools, but for the most part, they're not nearly as bad as the general population. I mean, they may be safer in school than they are, not being in school. And so while we're going to take every step we can to keep our kids safe, and we want to encourage them to get vaccinated, but we don't think closing schools and sending kids home for virtual learning is the way to go. So we agree with that.
I have a question about the National Guard. Is that
Sure.
okay? Excuse me, can you address concerns by some local jurisdictions that activating members of the Guard to help first responders will just further deplete those ranks of EMS and nurses, so many of them are Guard members, and are the Guard members being activated fully vaccinated?
I'll answer your second question first. The answer is yes. I cannot activate them unless they are vaccinated. It's a requirement with the type of orders that we're on. The first question's our overall objective is to not, we want to be additive to the community. So our overall objective is to not call up people who are also fighting COVID in civilian jobs. However, I'm going to leave that to the chain of command to make the onesie-twosie decisions. We're calling up entire units based on the size of this organization, and I'm going to leave it up to the chain of command to make those types of decisions about whether or not we're actually being additive or not.
Do you have a stance on testing to stay out or testing negative to come into school? Do you think various school districts should require negative tests for teachers or students?
These are decisions that the local health departments and the local school boards can make on their own. I understand they're trying to keep kids in school and perhaps, making sure that they do more testing, which is one of the reasons why we provided unlimited testing to the school systems and why we put so much money into the schools and emergency funding. But I don't know the exact details about what each individual local school system is deciding with respect to testing.
And back to the treatments, I know you say there's a shortage, but can you speak to the amount of availability that Maryland currently has and the estimate for people that can be helped at this point?
I'm sorry, the
The different treatments, I know you say there's
Yes.
a shortage. Are there none available? Are there some? Academic multiple different.
Yeah, well, we have an unlimited, I think, amount of the things that work for the previous variant, but not the one that's for the current Omicron variant, and that's one of the things we'll be discussing with the White House later today. There's it's not a Maryland shortage, it's a nationwide shortage, and I'm hoping that that's one of the things that the President might address today, in addition to talking with us and some fellow governors immediately after this press conference. I think he plans on saying something today about the crisis, and I hope he'll address the shortage of monoclonal antibodies. And I'd like to hear more about the 500 million home tests they were going to send out to everybody across the country, and we've heard absolutely no details about that.
Is who's in the hospital evolving, changing at all? Like a couple of weeks ago, or a week ago, I think I was told it was still mostly Delta because of Omicron's increase. Is the percentage of vaccinated in the hospital coming up at all, or is it still holding at what we saw?
Well, maybe I'll turn that over to Dr. Chan or Secretary Schrader, maybe. Yes, it's changing. We still have the 8% of the folks in the state who are unvaccinated are now, I think, about 45% of the hospitalizations, but that small percentage is still almost half. The other 90% is now, is making up the other 40-some%. So there are people who are, vaccinated, but not fully vaccinated, that are ending up in the hospital. They're not boosted, which is one of the reasons why we keep stressing that.
Cohort is changing.
It is changing. It's changing all across the country, and Omicron is overtaking Delta. Luckily, it's not. We are getting more people in ICU. We got more people in the hospital because it's so contagious and everyone's catching it. But it's not as deadly, and we don't have as many deaths, and it's a lower rate. So it's just an overwhelming number. But I don't know if there's anything the Secretary wants to add to that.
No, Governor, you said it very well. We are tracking the Omicron, Delta. Omicron has been rising, but the Delta's still there. And we're working with our sequencing, and we're using a technique called PCR S-gene dropout, which is a PCR test that allows us to know very soon. So, but we are seeing Omicron rising. No, actually, the number of vaccinated has been stable. It's still about 70, as the governor said, 70, 80%. So if you are unvaccinated, you are the one that is most likely to be in the hospital, unfortunately. So that's why we're continuing to push vaccinations.
Yeah, sorry, I might have misstated that, but it's it is changing dramatically from all Delta to nearly half and half at this point, but it's not changing so much with respect to vaccinated versus unvaccinated. Those are things that, we're obviously, we've been discussing for 2 years now, or, the vaccines for more than a year, and we'll continue to talk about it every day. Right now, today, we're taking, we took a huge number of steps last week and the week before, over the past 30 days. These are the ones we're going to take today. I can't say what we may or may not do at any point in the future, but right now we think this is the appropriate action. Thank you.